Hi, this is Jessica DeMassa at the HISA Studio here at HIC 2017. I'm here with Michael. Michael, tell everybody who you are, please.
Michael Georgeff, CEO of Precedence Health Care.
Good to meet you. And so tell me a little bit about what you do, what Precedence Health Care does.
Okay, so Precedence is focused on chronic disease and complex care, particularly involving a care team where you need collaborative care.
Okay, so we've been hearing a lot about this, and we've been hearing a lot about interoperability and decision support tools, things like that. Is that the area of work that you're in?
Yeah, not really. I mean,
Okay.
fundamentally we're focused on two elements, or we started being focused on two elements. So the first one is connectivity, which
Okay.
is around getting the care team connected with one another. So being able to have a seamlessly connected group of providers and the patient, so that the patient has this care team that's looking after them.
Okay.
And the second element is around being able, which a lot of people think of as care plans, but it's actually being able to track not only the health status of the patient through a shared health record, but being able to track what everyone on the care team should be doing and what they are doing.
Okay.
So it's tracking the patient and the carers as well.
Okay, so talk to me, let's go back to the first point about connectivity. So how are you enabling better connectivity among all of those different groups? I mean, the care team, the physicians, the patient.
Yeah, so fundamentally I think when we started, everyone was, or most people were trying to connect organisations to one another through quite heavy duty connectivity and standardised interfaces between systems.
Okay.
Whereas our focus was to use the web. In other words, we believe that what you could think of as a lightweight connectivity where everyone can connect via their browser, so much more like you connect into a banking website. And we would connect to a few, and do connect to a few key data sources like GP desktops. As soon as, if you're a GP and you open the patient record and you use our system, we automatically connect in, and that patient gets connected to our web or cloud service. And the other data sources are things like My Health Record and so forth.
And now what kind of outcomes are you seeing amongst the patients in terms of not only the connectivity, but also the other side where everybody's kind of held accountable to the care plan?
Yeah, so what happens in Australia, and it's sort of pretty typical, is firstly not as many people are on care plans as should be.
Okay.
But of those that are on care plans, less than 20% are ever followed up. So one of the key issues is, and this is why we track what the care team's doing, one of the key issues is how do you ensure adequate follow-up? Because care plan's not much use without the follow-up.
Sure.
So in our university trials, I think we increased follow-up by a factor of 5-fold. We improved the typical outcomes like HbA1c. So there are significant patient outcomes, but more than that was the quality of care. In other words, because we're tracking the care team and keeping them informed about the actions they're meant to do, we managed to make sure that people followed the processes of care, did the reviews, did the actions they were meant to do in a much better than they were doing before.
That's fantastic.
Simply because I think collaborative care is very hard. Mm-hmm. So you need to somehow use the IT to enable those processes.
That's fantastic. Last question for you. I'm curious to know, I mean, in your line of work, what are you most excited about in terms of technology that's kind of coming down the pike here and being integrated into healthcare?
Right, I thought you were going to ask what I was most frustrated about.
Well, would you rather talk about that? You can tell me what you're most frustrated about. Right. We'll start there.
I'll start there. So I think the frustration is that healthcare the providers of healthcare are very difficult to move from their traditional workflows into the new models of care that they need to move into. And I actually think you see in the US, even despite how bad that healthcare system is, you do find a lot of providers moving quite rapidly into more coordinated care. And so you get, for example, GP practices which have a lot of nurses, and they follow up and they make sure patients come in for regular review and so forth. So I think part of the frustration in healthcare in Australia is it's a very locked-in system, and it's very hard to get providers to move, and I think that's typical of healthcare everywhere, actually.
I agree with you.
So that's always a frustration for an IT person. But in terms of the things that I think are exciting,
Yeah, let's end on a high note.
that's yeah. So I think the connectivity is essential. I think as soon as you get patients and providers connected, and then you can start to, and so underlying our system is what we call as a coordinated care platform.
Sure.
But once you get that connectivity, then you can start to plug in a whole lot of stuff. You can plug in wearables, you can plug in educational content, you can target it to the patient. So I guess the exciting thing for me is the ability to have an open, connected hub, and then to drive that with a whole lot of the mobile technologies and things.
Fantastic, and maybe that'll help shift the paradigm, I guess, in thinking as well.
Because you start to drive consumers, and they'll be the ones that'll start to force that change.
Fantastic. Well, thank you so much for joining us and for sharing your perspective with us here in the HISA Studio. This is Jessica DeMassa from HIC 2017.